Okay, I'm going to present about symptoms of damage to the brachial plexus, radial, ulnar, and median nerves. Okay, the introduction. Let's see what is brachial plexus structure. The brachial plexus is a band of nerve that stems from nerve roots in the cervical to the dorsal section of the spinal cord, which is from T1 to from C. Hello? From the C6 to T1, okay? Then it ends up in 5 major nerve branches that extend down the arm. So basically, brachial plexus starts from the shoulder and goes to the arm, to the hand. And the major nerve branches are musculocutaneous, axillary, median, radial, and ulnar. For the median, okay, here you see how it branches. I'll be specific for the median, radial, and ulnar. The median root, as you can see, starts from the C6 to T1, and it enables movement in the forearm and parts of the hand, as it innervates the flexor muscles in the forearm and intrinsic muscles of the thumb. And for the radial nerve, the root is from C5 to T1, and it controls various muscles in the upper arm, in the elbow, forearm, and the hand. For the ulnar, the root is from C8 to T1, and it controls basic fingers, control fingers. Next. Okay, here is about brachial plexus symptoms. When there is a lesion of brachial plexus or there is a damage of the nerve due to certain causes, like due to medical trauma, like maybe there is damage by an injection or there is a nerve being cut during surgical procedure. So it might cause some symptoms on the arm, like there'll be a feeling like an electric shock or a burning sensation shooting down to the arm and numbness. Also, there'll be weakness or inability to use certain muscles for the hand and the shoulder. And then there'll be complete lack of movement and feeling in your arm, including the shoulder and hands. Also, severe pain is included. And during childbirth, some brachial plexus damage can happen, which it can cause Erb's palsy and Klumpke palsy. For the Erb's palsy, this is a common injury of the upper brachial plexus nerve. It causes numbness and loss of motion around the shoulder and inability to flex the elbow and to lift the arm. So there'll be like a limpy shoulder or a limpy hand. And for the Klumpke's palsy, it's a less common injury that affects the lower brachial plexus, leading to loss of motion or sensation in the wrist and the hand, such as being unable to move the fingers. You'll not be able to coordinate the fingers. Okay, radial nerve symptoms. Here you see the diagram of the wrist drop. A patient cannot extend the wrist. So the symptoms are numbness from the triceps down to the finger, because the radial nerve innervates from the shoulder to the hand. So some muscles like triceps and biceps, there'll be numbness on those muscles, and problem extending the wrist or fingers, pinching and grasping problems, weakness or inability to control muscles from the triceps down the finger, and there'll be wrist drop. Also for the pain is sharp and burning. Ulnar nerve. When there's a lesion in ulnar nerve, you'll be noticing weakness or tenderness in the hand. In the hand, as you see from the diagram, it will be clawing. Like when you ask a patient to extend the fingers, he or she cannot extend the fourth and the fifth finger. So it looks like a claw hand. And also there'll be tenderness in the elbow joint. Median, when there's a lesion of median nerve, the symptoms will be difficulty or even ability to turn the hand over or flex the wrist down. That is the hand of benediction. So there'll be numbness on the thumb, the forearm, and the three adjacent fingers. The thumb, the first and the second finger. Also, there'll be weakness with gripping and inability to move the thumb across the palm. Because median nerve, it innervates the thumb, first finger, and the second finger. It also innervates the flexor muscles in the forearm. Next. Thank you for your attention. Any question or addition?
Okay, doctor, I'm next. I already sent my presentation.
Okay, Jenny, just a moment.